What is Crohn's disease? This might be a disease you've never heard of, but it doesn't make it any less dangerous. Crohn's disease is a type of inflammatory bowel disease or IBD. It causes inflammation of your digestive tract, which can lead to abdominal pain, severe diarrhea, fatigue, weight loss, and malnutrition. Inflammation caused by Crohn's disease can involve different areas of the digestive tract in different people. This inflammation often spreads into the deeper layers of the bowel. Crohn's disease can be both painful and debilitating and sometimes may lead to life-threatening complications. While there's no known cure for Crohn's disease, therapies can greatly reduce its signs and symptoms and even bring about long-term remission and healing of inflammation. With treatment, many people with Crohn's disease are able to function well. Symptoms of Crohn's disease. Signs and symptoms of Crohn's disease can range from mild to severe. They usually develop gradually, but sometimes will come on suddenly without warning. You may also have periods of times where you have no signs or symptoms or remission. When the disease is active, signs and symptoms may include diarrhea, fever, fatigue, abdominal pain and cramping, blood in your stool, mouth sores, reduced appetite and weight loss, pain or drainage near around the anus due to inflammation from a tunnel into the skin or fistula. Other signs and symptoms. People with severe Crohn's disease may also experience inflammation of skin, eyes, and joints, inflammation of the liver or bile ducts, kidney stones, iron deficiency or anemia, delayed growth or sexual development in children. Causes of Crohn's disease. The exact cause of Crohn's disease remains unknown. Previously, diet and stress were suspected, but now doctors know that these factors may aggravate but don't cause Crohn's disease. Several factors such as heredity and a malfunctioning immune system likely play a role in its development. Immune system. It's possible that a virus or bacteria may trigger Crohn's disease. However, scientists have yet to identify such a trigger. When your immune system tries to fight off the invading microorganism, an abnormal immune response causes the immune system to attack the cells in the digestive tract too. Heredity. Crohn's is more common in people who have family members with the disease, so genes may play a role in making people more susceptible. However, most people with Crohn's disease don't have family history of the disease. Risk factors. Risk factors for Crohn's disease may include age. Crohn's disease can occur at any age, but you're likely to develop the condition when you're young. Most people who develop Crohn's disease are diagnosed before they're around 30 years old. Ethnicity. Although Crohn's disease can affect any ethnic groups, whites have the highest risk, especially people of Eastern European or Jewish descent. However, the incidence of Crohn's disease is increasing among Black people who live in North America and the United Kingdom. Family history. You're at higher risk if you have first-degree relatives such as a parent, sibling, or child with the disease, as 1 in 5 people with Crohn's disease has a family member with the disease. Cigarette smoking. Cigarette smoking is the most important controllable risk factor for developing Crohn's disease. Smoking also leads to more severe disease and a greater risk of having surgery. If you smoke, it's important to stop. Non-steroidal anti-inflammatory medications. These include ibuprofen like Advil, Motrin, IB, and others, naproxen sodium like Aleve, diclofenac sodium, and others. While they do not cause Crohn's disease, they can lead to inflammation of the bowel that makes Crohn's disease worse. Diagnosis for Crohn's disease. Your doctor will likely diagnose Crohn's disease only after ruling out all the other possible causes for signs and symptoms. There is no single test to diagnose Crohn's disease. Your doctor will likely use a combination of tests to help confirm a diagnosis of Crohn's disease. Lab tests. Blood tests. Your doctor may suggest blood tests to check for anemia, a condition in which there aren't enough red blood cells to carry adequate oxygen to your tissues, or to check for signs of infection. Stool studies. You may need to provide a stool sample so that your doctor can test for hidden occult blood or organisms, such as parasites, in your stool. Procedures. Colonoscopy. This test allows your doctor to view your entire colon at the very end of your ileum, using a thin, flexible, lighted tube with a camera at the end. During this procedure, your doctor can also take small samples of tissue or biopsy for laboratory analysis, which may help to make a diagnosis. Clusters of inflammatory cells called granulomas, if present, help essentially confirm the diagnosis of Crohn's. Computerized tomography or CT. You may have a CT scan, which is a special X-ray technique that provides more details than a standard X-ray does. This test looks at the entire bowel as well as the tissues outside the bowel. CT enterography is a special CT scan that provides better images of the small bowel. This test has replaced barium X-rays in many medical centers. Magnetic resonance imaging or MRI. An MRI scanner uses a magnetic field and radio waves to create detailed images of organs and tissues. MRI is particularly useful for evaluating a fistula around the anal area, pelvic MRI, or the small intestine, MR enterography. Capsule endoscopy. For this test, you swallow a capsule that has a camera in it. The camera takes pictures of your small intestine and transmits them to a recorder you wear on your belt. The images then are downloaded to a computer displayed on a monitor and checked for signs of Crohn's disease. The camera exits your body painlessly in your stool. You may still need endoscopy with biopsy to confirm the diagnosis of Crohn's disease. Capsule endoscopy should not be performed if there is a bowel obstruction. Balloon-assisted enteroscopy. For this test, a scope is used in conjunction with a device called an overtube. This enables the doctor to look further into the small bowel where standard endoscopes don't reach. This technique is useful when capsule endoscopy shows abnormalities, but the diagnosis is still in question. Treatments for Crohn's disease. There is currently no cure for Crohn's disease, and there is no single treatment that works for everyone. One goal of medical treatment is to reduce the inflammation that triggers your signs and symptoms. Another goal is to improve long-term prognosis by limiting complications. In the best cases, this may lead not only to symptom relief, but also to long-term remission. Anti-inflammatory drugs. Anti-inflammatory drugs are often the first step in the treatment of inflammatory bowel disease. They include corticosteroids. Corticosteroids such as prednisone and budesonide can help reduce inflammation in your body, but they don't work for everyone with Crohn's disease. Doctors generally use them only if you don't respond to other treatments. Corticosteroids may be used for short-term, like 3 to 4 months symptom improvement, and to reduce remission. Corticosteroids may also be used in combination with an immune system suppressor. Oral 5-aminosalicylates. These drugs include sulfasalazine, like azulfadine, which contains sulfa, and mesalamine, like Asacol HD, Delzacol, and others. Oral 5-aminosalicylates have been widely used in the past, but are now generally considered of very limited benefit. Immune system suppressors. These drugs also reduce inflammation, but they target your immune system, which produces the substances that cause inflammation. For some people, a combination of these drugs work better than one drug alone. Immune system suppressors include azathioprine like Azazan or Imuran, and mercaptopurin like Purinthol or Purixan. These are most widely used immunosuppressants for treatment of inflammatory bowel disease. Taking them requires that you follow up closely with your doctor and have your blood checked regularly to look at the side effects, such as lowered resistance to infection and inflammation of the liver. They may also cause nausea and vomiting. Methotrexate like Trexol. This drug is sometimes used for people with Crohn's disease who don't respond well to other medications. You will need to be followed closely for side effects. Nutrition therapy. Your doctor may recommend a special diet given by mouth or a feeding tube, like enteral nutrition, or nutrients infused into a vein, like parenteral nutrition, to treat your Crohn's disease. This can improve your overall nutrition and allow the bowel to rest. Bowel rest can reduce inflammation in the short term. Your doctor may use nutrition therapy short term and combine it with medications such as immune system suppressors. Enteral and parenteral nutrition are typically used to get people healthier prior to surgery or when other medications fail to control symptoms. Your doctor may also recommend a low residue or low fiber diet to reduce the risk of intestinal blockage if you have a narrowed bowel structure. A low residue diet is designed to reduce the size and number of your stools. Surgery. If diet and lifestyle changes, drug therapy, and other treatments don't relieve your symptoms, your doctor may recommend surgery. Nearly half of those with Crohn's disease will require at least one surgery. However, surgery does not cure Crohn's disease. During surgery, your surgeon removes a damaged portion of your digestive tract and then reconnects the healthy sections. Surgery may also be used to close fistulas and drain abscesses. The benefits of surgery for Crohn's disease are usually temporary. The disease often recurs, frequently near the reconnected tissue. The best approach is to follow surgery with medication to minimize the risk of reoccurrence. Lifestyle and home remedies. Sometimes you may feel helpless when facing Crohn's disease, but changes in your lifestyle and diet may help control your symptoms and lengthen the time between flare-ups. Here are some general dietary suggestions that may help to manage your condition. Limit dairy products. Many people with inflammatory bowel disease find that problems such as diarrhea, abdominal pain, and gas improve by limiting or eliminating dairy products. You may be lactose intolerant, that is, your body cannot digest milk sugar or lactose in dairy foods. Using an enzyme product such as Lactaid may help. Eat small meals. You may find that you feel better after eating 5 or 6 meals a day rather than 2 or 3 larger ones. Drink plenty of liquids. Try to drink plenty of fluids every day. Water is best. Alcohol and beverages that contain caffeine stimulate your intestines and can make diarrhea worse, while carbonated drinks frequently produce gas. Consider multivitamins. Because Crohn's disease can interfere with your ability to absorb nutrients, and because your diet may be limited, multivitamin and mineral supplements are often helpful. Check with your doctor before taking any vitamins or supplements. Talk to a dietitian. If you begin to lose weight or your diet has become very limited, talk to a registered dietitian. Smoking. Smoking increases your risk of developing Crohn's disease, and once you have it, smoking can make it worse. People with Crohn's disease who smoke are more likely to have relapses and need medication and repeat surgeries. Quitting smoking can improve your overall health and your digestive tract, as well as provide many other health benefits. Stress. Although stress doesn't cause Crohn's disease, it can make your signs and symptoms worse and may trigger flare-ups. Although it's not always possible to avoid stress, you can learn ways to help manage it, such as exercise. Even mild exercise can help reduce stress, relieve depression, and normalize bowel function. Talk to your doctor about an exercise plan that's right for you. Biofeedback. This stress reduction technique may help you decrease muscle tension and slow your heart rate with the help of a feedback machine. The goal is to help you enter a relaxed state so that you can cope more easily with stress. Regular relaxation and breathing exercises. One way to cope with stress is to regularly relax and use techniques such as deep, slow breathing to calm down. You can take classes in yoga and meditation or use books, CDs, or DVDs at home. In the end, make sure to share your experience with us and don't forget to subscribe, share, and like.